So the magic thing that happened at the turn of the century was people got serious about global health, about really measuring, okay, kids die of diarrhea, but what caused that diarrhea? They die of pneumonia, malaria. Okay, it's more clear what that is. So the incentive system is, potentially could be improved. But the Gates Foundation, that's our place we come to fill in, is that the things that aren't market-driven, like getting diarrheal vaccines cheap enough for all the kids of the world, not just the rich kids who don't die of diarrhea, but that also used to be 500,000, now down to 100,000. So as we went from 10 million under 5 deaths per year at the turn of the century to 5 million, diarrhea was one of our best. Pneumonia, we got a vaccine out for that, which was a very expensive vaccine that we worked with all the vaccine companies, Western and Asian, to get those prices down. And so we're basically driven by the inequity, where we say, why do mothers die in childbirth 20 times as much in Africa? Why do kids die 50 times as much in their first 5 years in poor countries, particularly Africa, but also Southeast Asia? And so we're taking all of those and saying, okay, let's find the best scientists. Let's understand the field conditions. Is this stuff deliverable? Will it be accepted? We have crazy ways of killing mosquitoes. That alone doesn't get rid of malaria, but if you treat a lot of humans and the reinfection rate has been massively reduced, then you can get to the point the U.S. got to, because we had malaria, where you've cleared during the low season. That's the winter here and the dry season there. You've actually cleared the parasite, so there's no humans, so there's no reinfection taking place. And, in the next, hopefully well less than 20 years, we have 5 years now, we need to do the tools. So our goal is to finish polio during this 5 years, and then with new tools, get the credibility to get the world to fund a malaria eradication starting in 2030.